Great thing. So
Yeah.
I am honored that you come all the way from
No, I
Sydney.
really had trouble. So,
Where
and
you had
as you
trouble?
had predicted last around a year back,
First thing. How did you all land up over here?
because actually in 2018
Huh.
or 2017 to be 2017 November, I was just about to leave for Sydney,
Okay.
and a day back,
You're Sydney based.
yeah, I am
And
Sydney.
you've
I
been
am
Sydney based last 20 years.
last now it's 18 years.
18 years.
Last 18 years I am in Sydney.
Hmm.
And as you know, in Western world, the dental costs are quite high.
Hmm.
But what happened was when I came last year, last year,
Hmm.
I had a trouble just 2 days before leaving
Back to your
Mumbai.
country.
Yeah,
You called it that now your country.
yeah.
Huh.
Obviously, it's my country. It's my place.
Okay.
So before 2 days back, I had trouble, and then I rang up Dr. Mukund,
Huh.
and then he said, "Okay, come, we'll try to do something." And I was surprised to see
A
that
root
within
canal
one,
done.
one day
No, in one day I finished. A root canal was done
was
painlessly
done. Yeah,
in 15 minutes,
in 15 minutes.
start to finish.
Start to finish. No
Did the
problem.
injection hurt?
No, nothing hurt me.
Before, during, after, did it hurt?
No, nothing. Was
And in
perfect
24
job.
hours, I had the infrastructure to
Yeah.
give you a temporary cap.
I got a foot insert was put in my gums. The gums were cut, and even a temporary.
I used a laser to cut your gums.
Yeah,
Okay.
and that temporary crown was fixed. And next day I was in the flight to Sydney.
Okay.
I did had little troubles on the way because I was taking antibiotics and painkiller, but it was guaranteed to me for 1 year, and it lasted me 1 year and a month extra.
Okay.
And
When
that too, it happened while I was eating popcorn.
you must bring the popcorn. Maybe Australian popcorn is different from Indian
No,
popcorn.
that was not pop, and it really created broke
Okay,
my
so the temporary cap broke after 1 year, 1 month.
1 year,
Okay.
1 month.
Okay, now one more thing. When you experience this clinic, I have a thing for timing. I'm very good at timing, keeping people on timing and this thing.
Yeah,
Okay, how is the clinic atmosphere as far as hygiene and is it comparable to American or to Australian standards?
It is at par with the Australian standard. There is no difference between what is here and what is there.
In the equipment as well as
In
the
equipment, in
and the
the
care.
gloves, in water, in everything. Even if you see the cleaning procedures are excellent. I would not.
What about
say
our toilet? What do you have to say about our
toilet is excellent. Everything is neat.
You know,
and
we keep
clean.
it clean ourselves.
Yeah.
I don't hesitate to clean it.
Yeah.
Okay, means I motivate my boys to do it.
Yeah. No, that is what, because everybody
It's
has
a-
to do it
Whatever.
to keep a place clean.
Okay.
And that is what.
Now this time I believe you subsequently you sent me your daughter. Am I right?
Yeah. I send.
First
my
of
daughter.
all, you came to me not because you had only an emergency, but because you were referred by your sister Naushad, and Naushad had been referred by whom to me?
by a doctor who is now settled in US.
Who was working with me for
Yeah, she
5,
was
6
working
years.
with you,
Hmm.
and then Naushad referred it to me that
Okay.
you go and see
Yes.
Dr. Mukund, and then after the first visit, I realized it was excellent. Even
Is the
treatment.
atmosphere very humorous? I try to be humorous in my old
Yeah,
age.
yeah. Everything was excellent.
Okay, now just
I
now you
would have
came
not
back.
expected better than this.
Acha. Now you came down. How's our coffee, by the way? We serve.
Excellent.
Okay. Now, just now you came back again.
Yeah.
Okay,
Now
you
coming
came-
back to 2019, actually as I said before, my tooth was broken because of that corn, and also my cap had come out. I had a bridge which was just supported on a single tooth.
This is your Australian dentist told you.
Yeah. So my
But I had predicted this, I think, no?
yeah was
So you
gave
would
me a-
consider me of a dental astrologer?
obviously.
I love to joke.
Yeah.
I love to joke. I love to see my patients smile. Okay, so painless was that? Root
Yeah,
canals, gum surgery, yes.
Everything was painless.
Painless. The last time. This time when you came, the doctor told you that and that tooth was a wisdom tooth under which it was under a cap. Am I right?
Yeah, you're correct. The bridge had one wisdom tooth at the end, which I think before 20 years, I'm not sure, but was very hard to remove because my two wisdom tooth has been removed under surgery. So I was given anesthesia and they removed it and was very hard. For one day it was really painful for 24
Okay, so
hours.
I took about 45 minutes with an injection which was painless, almost painless.
Almost.
Okay, and this thing we removed the tooth which was broken,
Correct. Was
badly broken. There was
It was
nothing to be
taken out
seen.
in two pieces.
It was taken out in two pieces, and you had no trouble before,
no
during, or after. Am I right?
Yeah, perfectly.
I would
right.
like to ask you. Your wife has come with you, and this may say something in my presence. But what was his reaction at home? Was he in pain, suffering, whatever?
Over there he was suffering, but specifically.
There, no. You're just now after removing the wisdom tooth.
No, he was very happy. Like he was not in pain. Like he said, I need the pain. I asked the doctor if I need a painkiller, but he didn't need any painkiller.
No, that's because this thing. But so if you do, I'm incidentally writing a blog just now on
Okay,
painless
that's good.
surgery. That was a surgical removal.
Yeah.
And if I'm not mistaken, I charge you 15,000 rupees for that one tooth
Yeah.
surgical removal. And I
Yeah.
struggled a good 45 minutes.
Yeah.
And we had all instruments, shiny instruments, all this thing, and it was looking like an
Yeah, it was
operation.
very, very difficult. I realized it.
Okay. Now
It
we
was
have
not
done.
an easy task, and it was so embedded inside my gum that the doctor had to take 1 or 2 interval.
Do you know
just to
something?
pull out.
I offered it to you because some people have religious sentiments,
Yeah.
or they want to see whether the doctor has removed the tooth completely. So I always offer the patient, would you like to? It's allowed only in India.
Yeah.
Okay, it's not really allowed anywhere, not even in India. Okay, because it could be an infected tooth, and you don't know
Yeah,
how to
exactly.
dispose it.
Correct.
So normally, if I offer it and you say you want it, we throw it away. Means we give it to you after sterilizing it.
Okay.
Just like your needles or the gloves, we cut the gloves and throw them away. Okay, forget what the government is doing. Okay, we burn the needles. There are needle burners and needle cutters.
that's
So it cannot be reused. Otherwise, recycling is a major
Yeah.
thing in hospitals. You'll read about it in the papers. We ensure that it is not done by proper following. Incidentally, my boys also wear the sterile thing.
Yeah, gloves.
Even while washing the instruments, they wear new gloves. We do not have, and we are using the best possible gloves, nitrile gloves. So we talked
that's the
about
best.
painless extractions,
Yeah, painless extraction. Then
painless root canals. Okay,
Yes.
and now within 4 days, I think they were reinfected. They were
Yeah,
repeat
my
root canals. So we had to give
bottom.
7 days for healing.
Yeah,
Okay, but
exactly.
once we finish the root canals, within 4 days, am I giving you your permanent caps?
yeah, exactly.
And we are
Morning
giving
I
you
had a
the-
trial, and now I'm just getting a new caps, which will be perfect for me for a number of years to go.
Okay, and totally, would you say in this, including the repeat root canal, which has been done to international, and I share all my X-rays, okay, and my
yeah,
this thing, before, during, after, okay, in a total of 8 visits, would you say?
Yeah, almost 8 visits.
Almost 8 visits.
Almost 8.
and
8
finished.
or 9 or 7.
7, 8,
something
9,
like
7,
that.
8,
Yeah.
9 visits.
Yeah.
So this thing, technically, if it was not an infected root,
Was very easy.
no,
then.
infected tooth for the
Yeah.
root canal, I would have probably finished the case in 4 working days, including the caps, or
Agreed.
lesser,
Yeah.
or lesser.
I agree, fully agree with that.
That's all I got to say.
And the root
right?
canal was excellent.
So-
even the treatment, the laser
Oh, you can take
cutting
the
was
X-ray and show
excellent.
them anywhere in the world.
Yeah. No, I showed to my dentist over there
Huh.
because I was having on the email
Huh.
and he did not have any complaint. That means he accepted. So,
So, would you be kind enough to refer us more patients?
yeah, exactly.
And would you come back to us?
Yeah, obviously.
Okay.
I would prefer that. And
We are
I would
looking.
do that.
Your wife hasn't come. Your daughter has come to us, but your wife hasn't come. So we have to see when this thing. Let's see. So, madam, I don't know whether she wants to. When one day when she has a problem, but madam, we don't wait for problems. You know, we really
Yeah.
don't wait for problems. As I said, I'm a dental astrologer. I can predict where you are heading. It's with experience. It's with my experience, my training. I literally predict where you will be, not today, tomorrow. Where you will be 30 years down the line. I can predict. I'm trained for that.
Yeah, I
Okay.
agree with
Yeah.
Yeah. So I
You
can
have
predict.
a very good experience
so
Experience
with
and
you.
experience.
40 years. No. I just did a very advanced course. I have been doing smile design since 94. Okay. And just now the entire concepts, the paradigm has changed. Parameters have changed, and I just did an expensive course which cost me 55,000 for 4 days. Luckily, it was available in Bombay, otherwise it's available only in Budapest.
Okay.
Okay, and 4 days loss of earnings plus most
New
advanced
technology and all that.
Yes,
That
that's
is what is required now.
If you get onto my website, right, you will see that all my testimonials, the keyword is painless. We do an implant in 15 minutes.
Okay.
People have gone and played golf. It's mentioned in the testimonial. Someone has compared us to a Harley Street dentist. The Harley Street dentists are supposed to be the world's most expensive dentist. So, with that, and we use all the tactics, whatever, to ensure that you get spa-like dental treatment.
It was
Comparable
perfect,
to
excellent.
Thank you
and
for
I'm
your
happy
time.
with the treatment.
Thank you for your time. So now
nice.
we'll have some coffee.
Thank you.
Good.